Okay, so I'm interested to hear your reflections on your process. And this morning you shared a piece of writing with me in relation to your upcoming procedure.
Surgery,
hip replacement. And what I'm most curious about is your process in deciding to move forward as a somatic therapist who works to help people find alternative approaches to surgery in their own lives when they're dealing with chronic pain.
right. So, as with my hysterectomy, I did everything that was humanly possible to avoid surgery. In the case of my hysterectomy, by the time I did it, I was severely anemic, and I regret that I waited so long because I did damage to my overall well-being by being so resistant to having the fibroids and then ultimately my uterus taken out. And I think it took me years to recover from that. You know, the beauty of Western medicine is that there are times when you actually need the knife. You know, it's kind of like the energetic masculine to go in. We're living in a time where that's possible. And with my friends who've had hip replacements, they're like, why are you holding on to this hip that doesn't work anymore? I'm bone on the whole surface of my hip. And I manage it fine when I'm in Florida, but when I'm traveling, I can't manage it. I can't walk for more than 15 minutes. Taking a suitcase through the airport is really, really hard. Doing very, very simple things isn't a chore. There are days when going from my bed to the bathroom hurts, or getting out of the car and sitting for dinner. So when I went to the surgeon, who was highly recommended by people I respect, he said, Janice, you're bone on bone. I could give you a shot. I can't tell you how much money I'm spending trying to maintain my well-being given a hip that's very worn out. And
well, this isn't the first time in your life that you've been told you have bone on bone and you need surgery, right?
yeah, but before it was a little bone on bone. Now it's a lot bone on bone. When I had my first x-ray 4 years ago, it was a little tiny bit of bone on bone. Now the whole surface of the cartilage is gone. And I can get out of pain for days at a time and really feel good after I've had PT and I'm worked in the pool, but I can't last.
So when I've heard you share about the origins of your work in Body Dialogue, you've spoken about a neck injury that you had where you were told that you would need surgery. And
well, believe me, if someone told me I had to have neck surgery, I very seriously believed that unless it was life or death, I wouldn't let someone take a knife to my neck.
Yeah.
So hip surgery people have a lot of success with. Easier than knee. However, I'm only 70. I feel very young. I'm not quite 70 yet, and I feel very young, and I feel like I have maybe a few decades of healthy living. I want to keep dancing. I want to dance more. I want to be able to play with my grandkids and not like really be in so much pain when I come home from an outing with them that I have to lie on my back for an hour and get recalibrated. When I was told I needed neck surgery, I was 19 years old. And what they wanted to do was very risky. This is a pretty standard, I go in, I go out. I don't even have to stay overnight if I don't want to, which I will.
Right, they get you in and out quickly.
Right, and they get me walking right away. I actually want to say that I feel like as I go into 2020 and into my 70th year, I want more vitality. I want to feel more zest. I want more energetic liftoff. And this has been dragging me down. It's exhausting having chronic pain. And I just feel like as much as I'm frightened about putting my hands into somebody else's care. Putting my life and putting my hip into somebody else's care. He comes highly recommended. I'm going to do a lot of energetic work before I go in.
Mm-hmm.
I'm not just going in and saying, okay, I surrender. I'm doing meditation, I'm doing ceremony, I'm doing ritual. I'm like taking this
You're being an
very,
active participant.
Yeah,
in
and
the
I'm taking it very seriously. I didn't travel this December when I wanted to. I didn't, go visit my grandbabies, which I wanted to do because I didn't want to get sick. I didn't go up to New York to visit my daughter because I didn't want to get sick. I did a lot to say, this is a priority, and I'm going to go into it with consciousness and awakeness. And even though I can feel some resistance in me, I can feel this little part of me that's like, The other part of me is like, well, okay, let's let go of what's not needed anymore. And I actually have a part of my human design chart that says that I hold on to things too long.
Mm.
And maybe it's time to just let it go. Just let it go, let it go, let it go.
So can you speak more to the resistance? What is that?
The resistance is fear, and it's also the idea of giving up control. If I can go into the pool and walk for half an hour, I'm in charge of my body. I go into a knife, someone else is in charge of my body.
Mm-hmm.
My healing's going to be up to me.
Mm-hmm.
And according to this doctor, a lot of things that people face after surgery is not what I'm going to have to face. And the PTs have said, you're strong, Janice. You're going to bounce back. So visit me in a month. We're going to do a follow-up, and we'll have a conversation in a month and see whether or not everything that I'm anticipating can be turned into something good, and I might have a whole new insight into what
Mm-hmm.
this opportunity brings me.
Mm-hmm.
So it's now December 29th. The surgery is January 10th, 2020. Let's visit again in about a month after or 6 weeks after, and I'll have a report for those of you who are in this world of aging or whatever, having to make some of these decisions. Maybe I can be a help or a guide or a path cutter and bring some insight.
Mm-hmm. How to be in a conversation and be an active participant in your healing, even when you are using the tools of Western medicine.
Totally. I mean, it's 2020. These guys have spent a lot of time thinking about how to do this. And although there's been some dead ends for some people, for the most part, people just say, wow, you're going to feel so much better. So I'm going to trust all those people who said I'm going to feel better, even though right now I don't have any pain at all. Right now I'm like sitting here going, what are you talking about? But I do believe strongly that if I didn't know that for so many the quality of life is improved, it would be hard for me to go forward with this. But that's not what I'm hearing. When I was 19 and I was going to have neck surgery, I didn't know anyone that had neck surgery.
Mm-hmm.
And if you look at my neck today, there's a lot of deterioration in 3, 4, and 5 cervical vertebrae, but I'm never in pain. And I learned how to support my head with my torso and not just with my neck, and I don't have all that rigidity in here. And really so much of the work of body dialogue came from understanding how to work with the breath, and that the breath was the key. I can work with the breath in my hip, but it doesn't make the difference when I'm walking around the lake. I have to stop, I have to stretch, I have to stop, I have to come home, I have to ice. I mean, it's just much, much, much more challenging.
So as a practitioner, has anyone ever come to you after having been told by a doctor that they need surgery, and they come to you for an alternative approach?
I've worked with people before and after surgery, but I've never worked with someone who said, I want to avoid surgery, help me. No. Yes, in the case of back surgery, and definitely people who wanted to avoid neck surgery. But in my practice, I know, just as my body workers have told me, if I can get you out of pain and you can stay out of pain, it's one thing. But if I get you out of pain and a week later you're right back in the door because you can't maintain it, then you have to start considering alternatives. And like I said, if it were my neck, I probably would not be doing,
right.
I wouldn't be letting a knife come to my neck right now in my stage of life. But I'm doing this because I feel like some of my best friends have done this before me and said, Janice, go for it. So I think it's time to go for it.
So it must just be different for everybody, but using the tools of body dialogue, using the breath, using Alexander technique, oftentimes people can find ways to maintain new patterns and repattern what's causing chronic pain. But maybe sometimes there's real physiological...
No, sometimes when the physiology, meaning your body it has wear and tear. I mean, cartilage is there to protect the joint. When there's no cartilage, I've done a lot to try to rebuild cartilage, and I haven't done it successfully enough.
Mm-hmm.
There might be people who are more successful than me.
What can you do what have you tried?
There are herbs that I've been taking called cart,
mm-hmm.
and I've been doing chondroitin, and I take collagen, and I've been doing a lot of herbal and nutritional stuff. There might be more I can do. I'm sure inflammation from coffee and other inflammatory foods impact. If I lived someplace where this wasn't available, if I didn't have the means, if I didn't have Medicare, if this was coming out of pocket, I don't know, maybe I wouldn't be doing it.
Mm-hmm.
But this is what I want to say, and I think this is where we're going to end. I'm very interested in hearing from other people, and I'd like other people, meaning you who are listening, to come back and ask me questions like Maddie's asking me, because I think the most important thing is what's the dialogue you're having.
Mm-hmm.
And my work is about the dialogue. So yesterday I did a divination session and I got some tools for ceremony, and that was an important conversation. And I'll continue to be in the conversation, so enter the conversation with me and let's talk about it.
Good.